Hi, it's Dr. Spears, and the one thing they don't talk about in medicine is the racism that exists. I was just reading an article today. It's something I knew, it's something a lot of people know, but people don't want to acknowledge it. And it's about the racism in medicine, and what I'm referring to is African American women who are in labor and delivery, i.e., they're pregnant, they're going to the hospital, they have some pregnancy complications, or it's before even the birthing process takes place, and they're telling the doctor, the hospital staff that something's not right, and they're just being dismissed. And this is a problem that needs to be addressed because if you look at the statistics and look at the numbers, if you're an African American woman, you're 330% more likely to die or have pregnancy related complications than your white Caucasian counterparts. That's completely unacceptable and something needs to change. You can extrapolate all the data to all many types of points, and even if you take in people's socioeconomic demographics, their education, their earning, how much they make, their salary, income, health factors. If you make that all equal, African American women are getting the short end of the stick in our healthcare system. A lot of times there's just overt discrimination. I was reading an article and it even went on to say that it's even in like medical students themselves where they're dismissive of black patients. And in one study, 220 of the medical students or so believed falsely that black people had thicker skin or that they had higher pain tolerance, so they didn't need any pain medication or anything like that. And that's just a shame that these are the people who are going into medicine, are going to be the doctors that are going to be making decision calls on what should and shouldn't be done for patients. And so hopefully people become more aware of what's taking place and are doing steps to ask themselves, am I being biased? Am I treating this patient unfairly? Am I bringing in racism from my past? Or do I have certain things that I am projecting onto this patient that's not based in fact, science, or medicine? Those are the things that needs to happen because people should not be going to the hospital and having a bad experience. Too often people say, the doctors aren't listening to me, they're not giving me the attention that I deserve, and it happens at all types of levels. I'm going to break it down to you guys. I'm going to tell you a personal story from my background that just shows you what actually happens. Now, look at me, nice, young guy, charismatic, articulate, all the things that people want to say about you. That's supposed to be a compliment. Now, here's the thing. When I was a pre-med student at Northwestern University, I visit my grandfather on some of my spring breaks in Michigan. So I would take the train or whatever up to Michigan, visit him, and he had congestive heart failure. So if you know what that means, you're going to get some excess fluid, you're going to have a CHF exasperation, which going to mean you're going to have to go to the hospital. One time it happened when I was visiting him and we had to go to the hospital in the ER. And I'm just thinking, okay, these doctors seem kind of very dismissive, in and out the room, really not making too much of an effort to get to know the patient, my grandfather, see what's going on, or anything like that. And I'm just like, okay, this is probably because he's an elderly African American man, and they think, oh, we just see this all the time, we're not going to really pay too much attention to him, or maybe the staff is overworked. I'll give them the benefit of the doubt and say they're overworked, but that's not really what happened, because we're there for a couple hours or so, and then I'm studious pre-med, so what do I do when I'm on break in college or whatever, undergrad? I had my MCAT books because I was studying for the MCAT. So I had these books with me. And then one of the doctors came in the room and they looked over like, oh, what do you have there? I'm like, oh, I'm a student at Northwestern University and I'm studying for the MCAT. Oh, wow, you're pre-med. You want to go to medical school? You want to become a doctor? Yes. And everything changed from that moment. The doctor started talking to me. They explaining what they were doing. They told me some of the tests they were going to do. They talked about their medical background, their journey in medicine, and like, oh, what we're going to do for your grandpa and all of this other stuff, and spending more time in a room talking and everything like that. And I said, that's great that the doctors were nice and everything like that, but why weren't they like that from the beginning? Why didn't they engage us? Why didn't they give the best care that they could have given? And it's unfortunate that it took me having an MCAT book, them finding out that I went to a highly regarded undergrad institute, for them to change the dynamic of the doctor-patient relationship at that moment. And that's just really unfortunate because basically people get discarded, discriminated against, and just looked aside based on their race, ethnicity, socioeconomic status, and all of that. And it's just very unfortunate, and something needs to change. And you see it so often that people aren't getting the care that they need in these hospital settings. I know doctors are overworked, they have a lot going on, tensions are high. A lot of times patients will say, Doc, we've been in the ER for like so many hours or so, we haven't seen anybody, we need this, we need that, and doctors were swamped. I'm going to admit that there's a lot going on, and we have to triage patients. So if there's a code going on with a patient, obviously all my time and energy is going to be devoted to that patient, and then I'm going to have to come around and see the patients who are less acute and their needs can be addressed then. And that's just the nature of the beast when you come to an ER. But no matter what, I still give the best care to my patients. I'm very empathetic, understanding of them, and I also know that it's a very stressful time for a patient. And so those are just some things that are just coming to mind when it comes to this in the medical setting. But overall, as a provider, are you really doing what's best for your patients? Are you doing what's going to help them out? And like, are you doing your part to make sure you're providing high quality of care and not just saying, oh, this person isn't white, they're not Caucasian, so I'm going to treat them a little bit differently. I'm going to be a little bit dismissive. I'm going to just have certain biases like, oh, they're just drug-seeking patients, or they don't need something, or I'm going to just do my medical care for this patient. That's going to be easier for me as a physician and not what's going to be in the patient's best interest. Those are the things that you need to really watch out for. And for the patients who are reading this, or not reading this, but are seeing this video, here's something that you can do. When you're in the hospital, whenever you're in a medical setting, and you have somebody who can come with you, here's what I want you to do. I know you have your ride and die friends, the people that will go to the end of the world for you. However, that's not who you need to bring to the hospital. You need to bring the person who can de-escalate situations, people who are calm, who look to see the good in things and aren't trying to escalate and make things difficult. Because if you come to the hospital and you have somebody who you know has a temper, who's going to make an outburst and going to make a scene, that doesn't help anybody, because then you know what happens? I have to spend my time trying to talk this other person down, calm them down, get security involved if it even escalates to that, and that's time that could be spent addressing your medical situation, your medical needs, or the other patients. I see this all the time where people come in and they want to get in a doctor's face, they want to get in a nurse's face or whatever, and just make a big scene. That doesn't help anybody. That's not going to help your cause. I I understand that you're stressed, that you're sick, and you have a lot going on, but not everybody thinks like that. You have some people like, okay, you're going to cause a scene. Well, you know what? I'm going to give you the lowest effort of care possible because you're just being a problem. And so you don't want to do that. You don't want to bring people with you to the hospital who you know are going to be a problem, who are going to kind of act out or do more things in a certain manner that's not going to help your cause or situation. Obviously, you don't want to be in a situation where you feel like you're being discounted or anything like that. That's not what we want to happen for you, and that's why I'm kind of sharing these tidbits and advice for you. But as somebody who practiced OB-GYN medicine and stuff like that, my heart breaks for the African American women and any patient or whatever you have a 330% more likely chance of having an adverse outcome purely because of your race when you stratify for all other type of risk factors, medical conditions, socioeconomic levels, education, all of that. That's unfortunate. That just says that there's a bias, there's systematic problems that need to be addressed, that need to be changed so that people can walk into the hospital and have good outcomes. And people know me. I have my little joke that I like to say about OB-GYN. I'm like, yeah, we're the only specialty where people are actually happy to come to the hospital. And I want that to be the case. I want it to be, we celebrate birthdays every day that we come to work and stuff like that. And patients are happy to come and they leave with a positive outcome. Obviously, there are some things that are beyond a physician's control that happens in the labor and delivery process and just obstetrics and gynecology care that cannot have a positive outcome, but we do our best to make sure that everybody does within the limits of medicine and what we can do for you. So I just sharing some tidbits about all of the stuff that's happening, and it got me thinking about things, what I should be doing and what I can be doing, especially as an African American male, pursuing this career of OB-GYN and all the things that's going on. And so it just got me thinking about, okay, what can I do on a larger scale that's going to affect more than just the patients that I'm personally able to see, that's going to make a difference for people, or especially African American patients, when it comes to labor and delivery, so that they can have good outcomes, help deliver healthy babies, not have to deal with discrimination and everything like that. And so got some things that I'm thinking about, dream big, ambitious goals that certainly needed help so that everybody can have that experience that they want, because everybody just wants healthy babies, happy, healthy parents, and all of that good stuff. And so let's kind of just put our heads together, think what we can do on this topic, try to find some solutions, try to think outside the box and all of that, and just think what can be done. And I think one of the biggest things is education, patient education, physician education, nurse education, anybody in the hospital, and especially before you even get to the hospital. There's programs in this article, I think it was either, what was it? One of the Carolinas, I forget if it was North or South Carolina, and they have doulas who are people who actually worked with pregnant mothers to help them through the birthing process, like educate them. They're not midwives, they're not in there helping with the delivery process, but they can walk you through things, give you education, what to expect. They can be advocate for you, and you don't want to be alone when you're going into delivery, so they can be there with you, and they can kind of be your advocate through a calm, collected voice that of reason, and can kind of help you adhere or stick to your birthing plan if at all possible. So that's one thing that people should certainly think about or consider. And I think what they're doing on the legislative level is trying to expand that for more coverage of people from lower socioeconomic backgrounds who have access to those services, because the article is saying that middle class, upper income, higher income patients of different ethnic backgrounds, they typically have access to that services, or they can just pay out of pocket for that. And if you're lower income, Medicaid or Medicaid, I think that's what it is, they don't always cover that for you. And so that's something that needs to change, where more people can get access to that, because it's a lot easier to practice preventive medicine than to have a catastrophe take place and having to address that, like hemorrhages that take place after postpartum issues that occur, infections, low birth weight, and all of that stuff. We want to kind of prevent that from occurring in the first place, and eclampsia, preeclampsia, all of that. We want to do our job to make sure that by the time you come to the hospital, you're ready to deliver, you're the healthiest that you can be, and so that you can deliver the healthiest baby possible. And so just find that very eye-opening to just hear all of this stuff that's taking place with minority patients and the birthing process. And it really hits home, and it touches me in so many ways. And it's one of the reasons why I do this thing where I want to do OB-GYN and all of that, to really make a difference for patients, because as an African American male, I've been in the delivery room. I see like how the lack of minority patients and a difference that it can make for patients when they see people who look like them, who understand what's going on with them, and can really be that voice that they need, that advocate that they need, and just bring that trust and comfort to them during the delivery process and all of their healthcare needs. So just wanted to share that with you guys, and just make sure that we're doing things to address issues of racism in medicine is alive and well, and it's something that people shouldn't shy away from, like, gas, I even talk about this stuff, because it's true. It actually does happen. There are biases, there are problems in that, and it needs to be addressed, and it needs to be changed so that everybody can get the highest quality of care, and we can't just brush things under the rug and act like it doesn't exist. So that's why I'm sharing this with you guys, and just open your eyes to it, and just doing what I can do right now at this point in my career and my journey to make some changes and differences. And I think right now you got to be a vocal advocate for your patients, especially the ones who don't have the voice, don't have the economics to kind of get different levels of care that's out there. And so I want to make sure that everybody is getting the best that they can get, and that medical doctors, staff, nurses, support staff, everybody is thinking about the patient and putting the patient first, and not being biased or anything like that. So I've been talking for a while here. Don't want to start rambling, but these are my thoughts and what's going on, especially for African American women going through labor and delivery. And so this is Dr. Spears signing off, just having a talk with you guys about that, and open your guys' eyes up to what I'm seeing, experiencing, what the literature and the data is showing in regards to that, because it's horrific that African American women in labor and delivery are going to have 320, 330% more complications postpartum and just throughout the whole labor and delivery process. So that needs to change, and you can find me at drpremade.com. Again, Dr. Spears. Take care and enjoy. Bye.